The pandemic didn't change the daily toil of life as a farm worker. It changed how many are seen. Undocumented became essential. In Immokalee, Florida, we met Gloria Carrera in April.
Aquí tiene uno que hacer lo posible por trabajar.
Here you have to do what it takes to make a living, she said. For her, it was picking tomatoes to support her 2 children until the pandemic hit. The truth is you leave with fear that you'll come back home sick, fear that you could make your children, your family sick. Gloria stopped working. Most kept going, boarding buses to the fields. Some growers added hand-washing stations, but seeing that testing for COVID-19 lagged behind here, the coalition of Immokalee workers started ringing the alarm.
Because if you think about it, about the virus as a wildfire, we are dry tinder in a way.
This is what Collier County, where Immokalee is located, looks like now, a hotspot on Florida's COVID-19 map. We returned in June. One organization known for helping vulnerable populations around the globe, Doctors Without Borders, is actually here in Immokalee. You can see their volunteers there in the white vests. Susan Doyle says the organization recognized the need here.
They're not able to work from home, so they have to go to work every day. They're often living in quite crowded housing, using group transport to and from work. And it's particularly difficult to isolate for this population, so that's also very scary for them.
Gloria. We checked in with Gloria. So you went back to work for a few days, regresó a trabajar unos días.
Sí,
y dijo que ya no
porque
ya no había precaución, not enough precautions.
Traté de mejor proteger a mis hijos. Dije, no, me protejo yo y protejo a mis hijos.
You have to protect you in order to protect your children. Gloria has diabetes. Her partner's income is just enough to cover the rent. No tienen acceso al desempleo, right? You have no access to unemployment.
No tenemos eso.
You have no health insurance, no seguros.
No seguro ni nada de eso.
Y otra entrada no hay. What's the other income?
No hay otra entrada.
For her and so many others here, the concern is on 2 fronts: home and the home they left behind. I start thinking about my mother, she says. She's also diabetic. ¿A dónde vive ella? Where does she live?
En México.
Mexico, a country in the throes of the outbreak. Fears over what the virus could unleash upon Latin America first materialized here, Ecuador. It's believed a woman returning from Spain imported the virus. Within weeks, deaths overwhelmed the largest city, Guayaquil. Corpses were left on the street. At least 3,000 Ecuadorians have died, including colleagues of Dr. Luis Yepes, who we spoke with in April. We have to wait to mourn another time, he says. What we have to do is face the situation head on. As the virus spread throughout Latin America, the region's severe inequalities, poor social safety net, and fragile infrastructure were laid bare. Nowhere has that proven more true than the region's largest country, Brazil. President Jair Bolsonaro has not only refused to enact lockdowns, he has defied social distancing guidelines and recently tested positive himself. While Brazil's poorest neighborhoods, or favelas, were left to try to disinfect themselves. It's now the world's 2nd worst outbreak, behind only the United States.